morning. My name is Stephanie Downing.
And I'm Delaney Shield.
And you're watching SNDC News.
Reporting from the DMV area.
Gender roles are everywhere, in advertisements, toys, through body language, and the media. They are a societal norm which regulates certain behaviors and personality traits based solely on one's gender. However, several studies suggest that gender roles have a direct effect on a child's psychological development as they progress into adulthood. Based on gender differences, men are expected to be more independent, instrumental, and ambitious, whereas women are expected to express more emotions, be supportive, and be dependent. A study of 250 undergraduates at the University of Washington revealed that gender roles predicted personality factors and behaviors which were directly correlated to symptoms. Males had higher levels of achievement orientation, higher self-esteem, and active positive cognitive coping. Men had lower levels of avoidant coping and depression. On the other hand, women had higher levels of affiliation orientation and avoidant behavior, and lower levels of achievement orientation, active coping, antisocial behavior, and substance abuse. This study supports the idea that being extreme in either masculinity or femininity to the exclusion of the other gender is problematic for mental health, whereas when masculinity and femininity are balanced, they both promote positive aspects of mental health. Studies indicate several emotional differences between genders as children reach adolescence. Boys are more likely to hide feelings of sadness, and girls are less likely to express anger. By their teenage years, girls report greater intensity of emotions and more sadness, shame, and guilt, whereas boys are more likely to deny such feelings. Both studies suggest that gender roles play a significant role in determining one's behavior and psychology. Treating people differently based on one's gender and societal norms can affect one's persona and how they perceive themselves. People should not be limited from expressing themselves or pursuing their ambitions, yet unfortunately this is the reality of our society today. SNDC News will be right back after the break, with Mrs. Shield reporting on unfair treatment towards intersex people.
Hello, my name is Delaney, and today's story is about the unfair treatment of intersex individuals. People believe that there are only two sexes. This is incorrect because sexes are more fluid than the binary implies. This gray area is known as intersex, and it is a complicated idea to some, and it covers a range of biological reasons why a person does not fit into the societal binary. The three main reasons why a person is intersex is that their genitalia do not match their chromosomal sex, they have both sexes' genitalia, or the genitalia do not fit in the norm of what genitalia look like. About 1 to 4% of the world population is estimated to be intersex. That could equal about 2.7 million people in the United States alone. To put this into perspective, if the intersex population in the United States was as low as 1/10 of 1%, intersex individuals would be as common as people with Down syndrome. In most cases, an intersex individual is born. A doctor will perform a surgery to correct the deformed genitalia and not have a medical reason behind it or lie to the parents about why they need the surgery. Being born as an intersex is seen as a medical emergency. The troubling fact is that most intersex surgery is more aimed at a non-conforming males than non-conforming females. According to Alice Dreger, an American bioethicist, author, and former professor in clinical medical humanities and bioethics at the Feinberg School of Medicine, Northwestern University in Chicago, Illinois. Quote, surgeons seem to demand far more for a penis to count as successful than for a vagina to count as such. Indeed, the logic behind the tendency to assign the female gender in cases of intersexuality rests not only on the belief that boys need adequate penises, but also upon the opinion among surgeons that a functional vagina can be constructed in virtually everyone, while a functional penis is a much more difficult goal. This is true because much is expected of penises, especially by pediatric urologists, and very little vaginas, end quote. Forced surgery often leads to confusion and lying to the child and others, and this leads to discrimination and stigma in the healthcare system, and in many cases being subjected to lack of quality of care, institutional violence, and forced interventions throughout their lifetimes. In the United States, a sexual identity outside the female-male binary is a confusing idea. This leads to the medical standard of intersex infants in the United States to have constructive surgery aiming at normalizing external genitalia to fit societal expectations. These surgeries are not medically necessary. In addition, they often occur without informed consent. The medical approach cannot be changed without changing the legal view of intersex individuals. The main problem will occur if they try to marry or change identification documents. SNDC News will be back right after this break. A Roman soldier walks into a bar, holds up 2 fingers, and says, 5 beers, please.
What do you call a fake noodle? An impasta.
Why do seagulls live by the sea? Because if they live by the bay, they'll be bagels.
Why can't you give Elsa a balloon? Because she will let it go.
Let it go, can't hold it back anymore.
I'm Callie Levinger.
And I'm Natalie Fletcher, reporting to you live from the DMV metropolitan area.
The word tomboy is thrown around so much that most people probably don't know what it actually means. Tomboy is defined as a girl who behaves in a way that is perceived to be stereotypically boyish or masculine. Tomboys usually enjoy the company of boys and enjoy rough play outside. Society says that there are 2 genders, male and female, and doesn't consider that someone could be something else. They call little girls tomboys because they don't dress in the stereotypically frilly pink dresses and play with Barbies that most girls play with. When you call someone a tomboy, you imply that there's a regular way to be a girl and an abnormal way, tomboy being the abnormal way to be a girl. When people see the word tomboy, they think it is just a phase and that their kid will grow out of it, but most times it's who they want to be. Children's fiction is a popular place where you see tomboy characters such as Harriet from Harriet the Spy and Scout Finch from To Kill a Mockingbird. Even celebrity couples are subjected to the scrutiny of the word tomboy. Angelina Jolie and Brad Pitt's daughter, Shiloh, or as she prefers to be called, John, is one of the many young girls who would rather wear boys' clothes and do boys' activities. Most girls who go through a tomboy phase grow out of it by the time puberty hits because their parents encourage them, but sometimes they don't want to grow out of it, and that is seen as not okay by the public. Most families who have a daughter that is considered, quote, tomboy, unquote, don't correct people when they call their child a tomboy or assume that she's a boy. They feel it's not that important to correct people because their child is comfortable being that way. The word tomboy is an affirmative way that makes people think that boy and boy things are better than girls. Little girls are being victimized by society for being comfortable with who they are. If a girl is comfortable for wearing jeans and a t-shirt and playing outside in the mud with the boys, then there should be no issue. The issue here is labeling someone for what they like and are comfortable doing. Tomboys are and will always be a part of society.
In today's society, you are limited to checking a box of whether you are male or female. But what happens when you don't identify yourself as either of the 2? This is called no gender or genderless. Stories like Kelsey Beckham and Tyler Ford help other people understand what it's like to consider yourself as genderless. Tyler opens up to the public about their story and they never felt comfortable in their skin, always wanting to be someone other than their self. As a gender reassignment surgery become a male, Tyler felt a bit more comfortable with his own skin. But after a year, Tyler went off the hormone pills and came out as a genderless person, not having to worry about what to wear every day or how to act, but just how to be a person. Kelsey is 19 years old and identifies as agender, living in a world that no one quite understands. Kelsey explains to her friend Kristen that living as an agender person is like living on an island apart from the rest of the world. Kelsey states, quote, I don't want to be a girl wearing boys' clothes, nor do I want to be a girl presents as a boy. I just want to be a person who's recognized as a person. That's how I'm comfortable. I'm just a person wearing people clothes who likes to look at myself and have others see me how I am. Kelsey struggles with this from a day-to-day basis, never really getting the support from the people around her or society as a whole. There still isn't always a box to check other than female or male, and there still isn't gender-neutral bathrooms in public places. Society is such a gender-binary world, and when you don't identify yourself as male or female, there can be some complications and they can affect you for the rest of your life. But when people hear stories like Kelsey and Tyler, they can have more hope and confidence in themselves that even if not everyone accepts or understands them, it can still all work out in the end. This is SNDC News. We'll see you next time.